Hello, I'm Michael. Today we're looking at a critical safety factor often overlooked: workplace stress. Most organizations treat stress as an HR or well-being concern, but that's a mistake. Stress is a safety issue. It directly affects decision-making and reaction time, the same factors behind serious workplace incidents and fatalities. The numbers are undeniable. In recent years, over 960,000 workers were affected by work-related stress. Stress accounts for over 52% of all work-related ill health cases, causing millions of lost working days. The total cost of these health and injury issues is staggering, reaching nearly £23 billion annually. To manage this, we must distinguish between pressure and stress. Pressure can motivate us and improve performance. But stress occurs when demands exceed our ability to cope. It is sustained, harmful, and damaging. Crucially, stress is not a personality weakness. It is a work design failure. If your system creates excessive demand, stress is predictable. In safety terms, stressors are hazards, and stress is the harm. This framework maps directly onto standard safety concepts. This means stress belongs in your formal risk assessments, not just your HR policies or well-being initiatives. The HSE Management Standards define 6 categories of stress risk, including demands, control, and support. Employers have a legal duty to assess and control these risks. These standards are not optional, they are legally backed. Workplace stressors fall into layers: organizational, task-based, environmental, and psychosocial. Left unmanaged, these stressors lead to outcomes ranging from acute stress to chronic damage and total burnout. Stress does not stay in your head. It follows you onto the floor, directly impacting worker performance in hazardous environments. The cognitive impact is severe: reduced attention, slower decision-making, and memory gaps during critical tasks. Physically, it causes fatigue and slower reaction times, making employees far more prone to slips, trips, and falls. This is not optional, it is law. UK regulations require the identification and assessment of all risks, including psychosocial ones. International regulators like OSHA and NIOSH also confirm the direct link between stress and workplace injury rates. We must treat stress like any other hazard. Use the hierarchy of controls to manage it effectively. Start by eliminating root causes like excessive workloads and fixing staffing gaps to reduce the hazard at its source. Then, implement management controls and support systems, such as mental health resources and return-to-work processes. The focus must be on fixing the work, not just the worker. This requires organizational, management, and cultural changes. The HSE emphasizes prevention over reaction. The goal is to remove stressors before harm occurs, not just manage a breakdown. Failure to act leads to a predictable pattern. Normalizing high workload builds fatigue, leading to errors and eventually a serious incident. The actual root causes, poor system design, and inadequate resourcing are often ignored in post-incident investigations. If your risk assessment does not include psychosocial hazards, it is incomplete. Regulators know it, and the data confirms it. Managing stress is managing safety. It's time to act to protect your team. Thank you for watching. If this video was useful, share it with your team. Subscribe to the Toolbox Ready HSE channel on YouTube for new safety content posted regularly. Nobody gets hurt, everybody stays healthy. See you in the next one.